to Burkina Faso for the first time in winter of 2009. 80% of Burkina Bay, the people from Burkina Faso, live on under $2 a day. The birth rate for women is so high in Burkina Faso at almost 7 children to 1 mother. After hearing so many stories about women dying from childbirth, I wanted to do something about it, and that's when our team started researching and developing a program to reduce maternal mortality in Burkina Faso. So we realized that we couldn't just hand out pamphlets with information because over 80% of the population in Burkina Faso is illiterate. We also realized that 80% of the population lives in the rural areas where most of the maternal deaths happen. This means that with the decentralized federal government healthcare system, we would have to go village by village. Most of the women already know about the dangers of childbirth and family planning because they've seen their sisters and their friends die in childbirth. The thing is that they can't do anything about it. They don't have the power. So that ends in 1,000 abortion-related deaths per year. The key to our program is access to preventative medical care. We do this by offering each village a motorcycle and raising awareness about maternal health issues. First, we started in Ouagadougou, training Burkina Bay professionals to become program coordinators and lead the project. Then, these program coordinators went to each regional Center for Health and Social Promotion, the CSPS, with a motorcycle. They established a relationship with the workers to use the CSPS for meetings. For the first contact with the village, the program coordinators met with the village leaders who appointed 1 man and woman to become village volunteers. After the first contact, the program coordinators established a bi-monthly meeting time with the village volunteers at the CSPS. The village received 1 small gas can at each of these visits.
One of our most important partnerships was with the NGO Riders for Health, which was originally based out of Lesotho, but quickly spread throughout the rest of the continent. Basically, the NGO started when the founders traveled throughout southern Africa and saw all these vehicles that were vital for transportation to get people to and from medical centers and medical professionals in a complete state of disarray. So what they did was start this NGO in order to not only repair these vehicles and give vehicles to communities, but also promote community training so that these vehicles were maintained by the community for the community. So we went off of this idea by giving our volunteers the opportunity to get a motorcycle in order to transport not only themselves to and from our training facilities, but to have that motorcycle as a means of transportation for their entire community.
The program coordinators are the people that we worked with at the outset of the project, and they're the ones who really sustain the project. They developed a model which would be used for the community trainings, and it included information about not only antenatal care and nutrition, but also about how to incorporate the use of music and storytelling to use in the community trainings.
We knew that to successfully combat maternal mortality, we would have to take a community-based approach to the idea. And what we found was a local musician from Burkina Faso named Salif Molima Kone. And what he does is uses music to spread the messages of the suffering that goes on in his country, but also of hope. We thought this idea was absolutely brilliant, and we knew that if we could use music to spread our message, that we would have a very successful campaign. Through music like Salif's, we knew that we could access men as well, and they not only deserve to be involved in this process, but it's important for the entire family. And we realized that by using such a universal method such as music, we could make it easier for men to get involved in the process.
This program should be by Burkina Bay, for Burkina Bay, and that involves everything from the training curriculum to the village conversations themselves.
Mazubiro